Scapula. The lateral or glenoid angle is large and bears the glenoid cavity. The dorsal surface is convex and is divided by the triangular spine into the supraspinous and infraspinous fossae. The costal surface is occupied by the concave subscapular fossa to fit on the convex chest wall. The thickest lateral border runs from the glenoid cavity above to the inferior angle below. Surfaces. The costal surface or the subscapular fossa is concave and is directed medially and forwards. It is marked by 3 longitudinal ridges. Another thick ridge adjoins the lateral border. This part of the bone is almost rod-like. It acts as a lever for the action of the serratus anterior in overhead abduction of the arm. The dorsal surface gives attachment to the spine of the scapula, which divides the surface into a smaller supraspinous fossa and a larger infraspinous fossa. The 2 fossae are connected by the spinoglenoid notch, situated lateral to the root of the spine. Borders. The superior border is thin and shorter. Near the root of the coracoid process, it presents the suprascapular notch. The lateral border is thick. At the upper end, it presents the infraglenoid tubercle. The medial border is thin. It extends from the superior angle to the inferior angle. Angles. The superior angle is covered by the trapezius. The inferior angle is covered by the latissimus dorsi. It moves forwards round the chest when the arm is abducted. The lateral or the glenoid angle is broad and bears the glenoid cavity or the fossa, which is directed forwards laterally and slightly upwards. Processes. The spine or the spinous process is a triangular plate of bone with 3 borders and 2 surfaces. It divides the dorsal surface of the scapula into the supraspinous and infraspinous fossae. Its posterior border is called the crest of the spine. The crest has upper and lower lips. The acromion has 2 borders, medial and lateral, 2 surfaces, superior and inferior, and a facet for the clavicle. The coracoid process is directed forwards and slightly laterally. It is bent and finger-like. It is atavistic type of epiphysis. Attachments. The multipennate subscapularis arises from the medial 2/3 of the subscapular fossa. The supraspinatus arises from the medial 2/3 of the supraspinous fossa, including the upper surface of the spine. The infraspinatus arises from the medial 2/3 of the infraspinous fossa, including the lower surface of the spine. The deltoid arises from the lower border of the crest of the spine and from the lateral border of the acromion. The acromial fibers are multipennate. The trapezius is inserted into the upper border of the crest of the spine and into the medial border of the acromion. The serratus anterior is inserted along the medial border of the costal surface. 1 digitation from the superior angle to the root of the spine, 2 digitations to the medial border, and 5 digitations to the inferior angle. The long head of the biceps brachii arises from the supraglenoid tubercle and the short head from the lateral part of the tip of the coracoid process. The coracobrachialis arises from the medial part of the tip of the coracoid process. The Pectoralis Minor is inserted into the medial border and superior surface of the coracoid process. The long head of the triceps brachii arises from the infraglenoid tubercle. The Teres Minor arises by two slips from the upper two-thirds of the rough strip on the dorsal surface along the lateral border. The circumflex scapular artery lies between the two slips. The Teres Major arises from the lower one-third of the rough strip of the dorsal aspect of the lateral border. The levator scapulae is inserted along the dorsal aspect of the medial border from the superior angle up to the root of the spine. The rhomboid minor is inserted into the medial border of the dorsal aspect opposite the root of the spine. The rhomboid major is inserted into the medial border of the dorsal aspect between the root of the spine and the inferior angle. The inferior belly of the omohyoid arises from the upper border near the suprascapular notch. The margin of the glenoid cavity gives attachment to the capsule of the shoulder joint and to the glenoidal labrum. The margin of the facet on the medial aspect of the acromion gives attachment to the capsule of the acromioclavicular joint. The Coracoacromial Ligament is attached to the lateral border of the coracoid process and to the medial side of the tip of the acromion process. The coracohumeral ligament is attached to the root of the coracoid process. The coracoaclavicular ligament is attached to the coracoid process, the trapezoid part on the superior aspect, and the conoid part near the root. The transverse ligament bridges across the suprascapular notch and converts it into a foramen which transmits the suprascapular nerve. The suprascapular vessels lie above the ligament. The spinoglenoid ligament may bridge the spinoglenoid notch. The suprascapular vessels and nerve pass deep to it.